Polycystic ovarian syndrome is like an endocrinological. It's seen as an endocrinological. Hi, I'm Nate, a doctor specializing in women's health. Recently, we've covered a lot of topics relating to the pregnancy, so I decided perhaps we should cover something that isn't about the pregnancy. If you're enjoying these videos, now is your time to subscribe to the channel and give this video a like. Let's talk about polycystic ovaries, more specifically polycystic ovarian syndrome, or PCOS for short. About a third of women will have polycystic ovaries, while PCOS affects roughly 1 out of 10 women of childbearing age. Unfortunately, the exact cause of PCOS is yet to be known. There are probably several factors which can lead to a person developing the condition, which we call multifactorial. There's likely a genetic component, which means that if one or more of your family members has PCOS, then it's likely that you may have it too. Women with PCOS commonly have insulin resistance, which means that the cells in the body are less sensitive to normal amounts of insulin. A high level of luteinizing hormone is found in 4 out of 10 women with PCOS. High levels of luteinizing hormone and insulin resistance can lead to increased production of testosterone, which can cause some of the features of PCOS. It is also linked with obesity. Polycystic ovarian syndrome is now diagnosed based on the Rotterdam criteria. These criteria include having 12 or more cysts in one ovary, which we call polycystic ovary, or an ovary measuring greater than 10 ml in volume. These features can be identified with an ultrasound scan. Experiencing infrequent periods, known as oligomenorrhea, or having no menses for 6 months or longer, which is referred to as amenorrhea. A blood test showing high levels of testosterone, or having features of high testosterone levels, like excessive hair growth, especially on the face, which is called hirsutism, male pattern balding, and acne. If 2 out of 3 of these criteria are met, then the diagnosis of polycystic ovarian syndrome is made. This means that women with polycystic ovaries do not necessarily have polycystic ovarian syndrome, and women with polycystic ovarian syndrome will not necessarily have polycystic ovaries. I know, weird. And women are often diagnosed during their late teens or 20s. As many of the features are driven by hormonal changes, polycystic ovarian syndrome is seen as an endocrinological disorder. Like other hormonal disorders, PCOS affects many different body systems. It is a common cause of subfertility, which means that women with the condition can struggle with becoming pregnant. Due to the nature of insulin resistance, there's a higher risk of women with PCOS developing diabetes in pregnancy and later on in life. Women with PCOS are also likely to have high cholesterol levels, which we call dyslipidemia, as well as raised blood pressure, also known as hypertension. These issues, coupled with obesity, will increase the risk of heart attacks and strokes. Women living with PCOS are also associated with developing a sleep problem known as sleep apnea, which can worsen insulin resistance. Infrequent periods or no periods can lead to the lining of the womb to thicken, and this increases the risk of endometrial hyperplasia, or even endometrial cancer, especially in women with obesity. If you're worried you may have polycystic ovarian syndrome, please arrange to speak with your doctor, who can go through all your symptoms and arrange relevant investigations as required. In the next video, we'll go through ways we can help to manage PCOS. Give this video a like if you found this helpful, share, subscribe, and I'll see you again soon.